Progressive Liberal Party Senator Dr. the Honorable Michael Darville cautioned government not to repeal the Grand Bahama Port Area Investment Incentives Act, but instead work to strengthen it. Darville's comments came during his contribution to the budget debate on Friday. The Christie administration introduced the act last year after certain provisions, including real property tax exemptions, expired under the Hawksbill Creek Agreement in May 2015. It was intended to spur investment on the island, but the Free National Movement committed to repealing and replacing the act on the grounds that it does just the opposite and adds extra bureaucracy. Darville says repealing the act goes contrary to evidence based on research and would derail 3 years' worth of work by the former government.
I strongly suggest that this administration move with caution, review the evidence-based research that has been put in place that cost the government hard-earned dollars and is definitely done by reputable people. Look carefully at the MOU that we signed. Look at the heads of agreements signed by the government and with our stakeholders before potentially pushing Grand Bahama back another 10 years. Although I concede that the bill is not a perfect one, and I say that, Minister, because we all know who have served in these honorable chambers, that every bill that comes can always be improved upon. I strongly suggest that you improve the bill rather than repealing the bill.
Darville also disputed remarks made by Minister of Health Dr. the Honorable Dwayne Sands, who accused the former administration of being fiscally irresponsible during his budget contribution in the House of Assembly. Sands revealed that $90 million in contracts were issued before the general election and suggested the actions of the former administration negatively impacted the delivery of health care.
First and foremost, Madam President, the government never issued a $90 million worth of healthcare contracts weeks before the general election. Secondly, no contracts in the sum of $500,000 per month was ever issued at the Marsh Harbor Mini Hospital. Thirdly, no monthly contract in the sum of $424,000 was ever issued at the Exuma Mini Hospital. These false statements were reported to the print media. They went on social media, sending the wrong message to the Bahamian people. Although the minister did the honorable thing in the lower chamber by withdrawing the statement, the damage was already done.